9:15, the beginning of the year is a great time to prioritize taking care of your health. This is the time to be sure to schedule all your preventative screenings. They're vital to staying healthy, especially as you age. Dr. Sarah Schwertner joins us from Primary Care Plus to discuss preventative care and the importance of finding health concerns early. Good morning. Thanks for being here.
Good morning.
All right, let's talk about health screenings. What are health screenings exactly? What goes into them?
So health screenings are a type of test that your doctor can order that will basically can show cancer at early stages or medical conditions early on. So it's really important that you check with your doctor to find out exactly what you need.
And there's all different types of health screenings too. Like I guess if you're looking to detect early cancer signs, that's a different health screening than something like high blood pressure or something.
Yeah, so you can get with your primary care physician and discuss this, but some things would be like a mammogram, and they can detect breast cancer before you can even feel it. Diabetes screening, so hemoglobin A1C will check your blood sugar and what it's been the last 3 months, and things like colon cancer screening, colonoscopy can detect cancer at an early age.
Well, let me ask you this. How do you know which type of health screening is the one you need to get?
So really you want to check with your doctor, but it is different based on age, gender, family history. So the chance of, you detecting colon cancer when you have somebody in your family who's had colon cancer, you would probably have to get that colonoscopy at an earlier age, whereas someone with an average risk would get their colonoscopy at 45.
So it's really important to know your family history, know your health history when you go into these health screenings.
Yes.
And especially when you make the appointments.
Yes.
I know telehealth has been big over the last several years with the pandemic. Is that still something that people can take advantage of when it comes to health screenings, or are we seeing more in person, or can we do both? Is there an option?
Actually, you can do both. So mental health screenings for depression and anxiety, really you can do those through telehealth. Then you can also have home tests, such as colon cancer tests at home, where you send it in and you'll get your results. And then a lot of times, most of the preventive care has to be done either in person or in a lab or in a radiology facility. So there's a number of ways to screen.
And what a great time to really take control of your health with these preventative measures. It sounds super easy. How can people go about, scheduling appointments, or where to go to get a health screening?
So the number one person you go to is your primary care physician. But there's also community health centers. Even some pharmacies can do a minimal amount of screening for certain diseases. So there's a number of ways you can go and get checked out and prevent anything from turning into something that could have been prevented.
Yes. What are some other means of preventative care?
So we have colon cancer screening, like we talked about. We also have getting your flu shot, getting other vaccines, getting your annual wellness visit. So those are other ways that you can prevent things from being worse than if you just decide, you know what, I'm not going to go to a doctor, and it could be caught at an early age.
Yes, always good. And I know we're, a week or two into the new year, but it's never too late to kind of make a resolution and establish a goal. And what a great way to, again, take control of your health and maybe make 2023 the year that you take control of your health.
Absolutely. And I think it's really important that, everybody gets out there and find a primary care doctor and do the crucial catch like they talk about on football. Catch something before it's bad.
All right, Dr. Sarah Schwertner, thank you so much for being here this morning. We really do appreciate all the advice.
Thank you. Have a good day.